Good afternoon, dear Mr. Brian. Thank you very much for cooperation. And I would like to ask you the first question. Could you provide some examples of specific job roles or industries that are likely to be augmented rather than replaced by AI? And how can individuals prepare for this shift?
Okay, well, AI is not something to be feared. AI is a great opportunity. And I see it more in the context of augmenting human capability rather than replacing it. And I think the emphasis needs to be on how you can use the technology to give yourself superpowers, to basically raise your own capability to be able to analyse and deal with very complex problems. Of course, we often, the focus on AI is more on automating, routine or repetitive jobs and whatever. But what we should be really thinking about is that the new jobs that are created are those that require a higher order level of thinking. But to do that, you need AI to help you to be able to analyse all this information. And so in the context of Social Security Administration, I see the real opportunities is now in social policy and really being able to use the data, use the technologies to really tackle some of the really complex social policy problems that are still with us, despite all the progress that we've made in social protection over the last 40, 50 years.
Mm-hmm. How do you think, Mr. Brian, what is the role of AI in Kazakhstan and how it is going to develop as you as a professional, your own point of view and point of opinion?
Well, like what I've seen in Kazakhstan and in many other countries is that a lot of effort goes into using technology to digitise old existing processes. And it's fantastic, and you have now, technology platforms on your mobile phone that you can...
Everywhere.
Yeah, and you can reach out to the pension fund or whatever and submit information and get information. Those are what I call digitisation type initiatives. We've digitised an existing process and great progress has been made. But the next level is going to what we call digitalisation. I know in English we say digitisation, digitalisation. A lot of people think, isn't that the same? But they are actually two very different terms. Digitalisation is actually more about trying to do new things and doing things differently and using technology to help you do that. And that's where I come back to the previous question. It's about being able to make use of the data that you have now. We've digitised everything, so we've got access to these massive treasure troves of data. Now we've actually got to get smart and clever in how we use that data. And often, policymakers, the people who are thinking about social policy, when someone comes on to talk about technology, they will go, doesn't affect me. I'm a policymaker. That's more for people who are delivering, managing the delivery of, say, the pension scheme. Whereas the focus now, and I think, Kazakhstan, you're ready for this, is to say, we've made great progress on digitisation. We're now going to go to the next level of digitalisation, and it's the policymakers who've now really got to get involved and engaged in this technology. And that's a challenge, because a lot of policymakers, as I said, like to sit back and think technology, they use technology to do their modelling and whatever, but they're not necessarily really getting right into the deep technology that you need, which is where AI comes into place, to be able to really analyse data across the complexity of human life. Here we are talking today at this event. We're talking about pensions, and people's retirement. But of course, to get to retirement, you've got to work for 40 years, and you have a whole range of other social determinants affecting you over the life course. You get sick, your family gets sick, you've got to do caring. All those then will affect your pension outcome.
People factors, yeah.
Yeah. And they're the things you've got to get better at understanding the impact of those on people's lives.
Wow. Thank you very much, Brian, for a very deep and interesting answer.
Yeah.
So, Mr. Brian, the second question. What are some real-world examples of successful digitalization efforts that have improved outcomes through AI-driven data analysis?
On the one hand, I'd say we're still early days in getting to that level I've just been talking about. But there is some good examples happening out there. A region of the world which I think is the most advanced is the Scandinavian countries. So Norway, Sweden, Denmark, Finland. Look, for many years they've been leaders in many aspects of social security policy and administration, and in use of AI and whatever is no different. Finland is a country I really like to observe because they are a country who really looked at the dynamic between health and welfare. And one of the things around the social determinants is the impact of health. So health, our health outcomes affect all of us, and will affect our pension outcome when we get to the end of our working life. For many people, what impacts their health is a range of other social factors. Now, there are some health conditions that are it's in your genes. You can't. There's not much you can do about them. But there are a significant proportion of health conditions that are actually caused by a whole range of other social factors: education, where you live, the type of work that you do, and of course these things are all having an impact on your ability to work. And if you don't have the ability to work, then of course you're not going to be able to contribute to a pension or get a good pension outcome. So this link between welfare and health and welfare, and the term often used is the social determinants of health, is really important. And it's the Scandinavian countries, and Finland I think is one that is really doing, I think, a lot of really great work in this area. They're really looking at saying, well, we need to understand why people get sick. And we need to understand that if they're getting sick, they need a lot of other social welfare, social services facilities. And if we can bring those two together, then people will get better outcomes, they'll get back to work, back into the labour market. Too often, we'll see the health system is disconnected from the social security system. But of course, health systems, the costs are going up all around the world. And we look at health systems and how can we do something about the costs? But we need to look at the social factors that are actually driving people into the health system. Often I think the health system is there to pick up the pieces of some poor policy decisions that are being made in the social welfare side. And this is where I think the role for artificial intelligence is to really create those superpowers for policymakers to be able to think across the complexity of these sectors to see not just the correlations, but also the causality of what is driving people into the health system, which then affects their ability to work, ability to earn, contribute to a good pension outcome.
Pretty nice, pretty nice. Brian, you have mentioned mostly Scandinavian countries, and what can you say about Australia? How is it improving on, and your own point of view?
Yeah. Interesting. Australia is, of course, it's a very well-developed country. It's a very wealthy country, but at the same time, we have, there's pockets of disadvantage that have been very hard to address. And governments are often wondering why is this so? And there was an interesting thing happened during the pandemic. Australia has a safety net, social security safety net system, basically Pillar Zero type concept. People are virtually sort of eligible for benefits, even if they don't have any sort of contributory pensions or whatever. There's a means-tested system for unemployment benefits. People say those benefits are too low, and for years they've always been too low. Government has been reluctant to lift the rates because it's paid for by the state budget. And in the case of people who are unemployed, they were a very significantly disadvantaged group. So during the pandemic, the government, as an emergency response, doubled all the payments, doubled them for a significant period of time. Because that was part of the economic response that was needed for the fact that so much economic activity had come to a halt because of the pandemic and the lockdowns. What the data then started to show was that poverty levels decreased. Yeah. Not surprising, people had more money. But what was even more interesting was that when, again, detailed data analysis that was done revealed that people on low incomes who were getting unemployed and pensioners who really didn't have a private pension to look after them, where were they spending this extra money? Now the perception, the general perception at a political level and in some parts of the community was these people would not spend that money wisely. They would spend it on the wrong things. The data showed completely different. The data actually showed that they were actually spending it where you wanted them to spend it. Spending it on better food for themselves or their families. Spending it in areas that actually were good for their...
Some even entertainment.
Yeah.
Everything.
But right. Certainly not wasting it on, alcohol or gambling or whatever.
Drugs.
Yeah, all those sorts of things, which again there's, so I think what was a good example of, and from an Australian point of view, was the need to change people's attitudes towards the social protection system. And sometimes there's a tendency for people to get a view that this is a cost, and we're giving money out of the budget or whatever it's not being used wisely. Whereas in fact, this is about, the basic principles of social protection and looking after the people most in need. So for Australia, that was a wake-up call. That for a wealthy country, here we had a situation where we had people who really were struggling right under our noses, and we didn't sort of realise and understand and appreciate the impact on their lives. And as I say, it was that automatic doubling of the benefit. It was a positive outcome of the pandemic that we did that. We could see actually these people do need this more money, and so that has led to a slow. They've had to, they're not doubled the payments anymore. That the emergency is over, but they are now seeing the need to increase the benefits, the basic benefits, because the data showed that they weren't being paid enough, and they would use the money wisely.
Well, thanks a lot. Yeah, that's it. So we're moving on. Well, Mr. Bryan, as you're an independent advisor of social security and digital transformation, what are some specific policy LED use cases for AI in addressing social challenges, such as returning pension schemes and promoting transparency in pension contributions?
I think there's a range of areas here, and certainly the one that I think the most important, and it goes back to the previous questions, is this social determinant issue. Yeah. I'm sort of very passionate about that, and that we have to look at across all the different social policy pillars. Now, social policy is developed over, in social security over the last 100 years. And we have the traditional social policy pillars.
And different pillars as well?
These are vertical pillars around old age, employment or unemployment, maternity, children, disability. And they've all developed, and some countries cover all those schemes, others are still developing. Those traditional pillars have served us well, and we see this through the pension fund here. It's got it has its mandate and it's focused on building a very strong, sustainable pension system. But of course, the complexity of human life is that we pass through all those pillars at some stage, well, most of those pillars at some stage in our lives. So where we've got to improve, and again, this is where I think it's in the answer's in the data, and it's being able to use them and take advantage of the data and look for the help to find the answers, is being able to map and look through across the pillars. Now, it's not about saying throw the baby out with the bathwater, as we say, which is those traditional pillars, as I said, serve us well, and we don't want to try and change that. But we have to acknowledge that it is not always perfect. They can't cover every situation. And there are people who will consistently keep falling through the cracks. One of my arguments around digitisation initiatives is that we often will put more effort and investment into a new online platform, but often what's happening is you're giving a better service to people who are already well serviced. It's like your bank. Your bank will give you a new online banking platform, mobile banking, and you'll think, oh, this is fantastic. Well, they're doing that because they want you to do more business with them.
Yeah, it's very easy even to use.
Yeah, and as a consumer you think this is fantastic. But in social security, the effort has to be, well, we've got a lot of people who are well serviced, but we've got to find those pockets of disadvantage, and it's not going to be a service delivery digitisation initiative that's going to get to them. We've actually got to come up with new policy ideas and policy thinking to find ways to actually reach those people. And to me, that is where the new challenges lie, and that's where for the pension fund, that again, stick to your mandate, but also recognising, but there will be people who will reach pension age, may have contributed for many years, but unfortunately will have a poor pension outcome because they couldn't work for many years, or they had a range of barriers they couldn't overcome. As a pension fund, you might say, well, okay, we've done our job, but someone else has got to help pick up the pieces for those people who do, who are disadvantaged. And so for the pension fund then, it's about, okay, how can we collaborate and coordinate ourselves with those other actors, state actors and private actors, to make sure that when people reach that retirement age, irrespective of whether they've got a great, a really sustainable pension, adequate pension, the ones who don't, hey, we haven't forgotten them either, and we're still looking for ways to be able to help them and address their needs.
Mr. Bryan, you as a professional, can you tell us the basic advantages and disadvantages of AI?
The main, let me start with the disadvantages, and then I'll finish on a good note. And look, there are risks, and AI brings plenty of risks. You're dealing with people's personal data. You have a situation of information asymmetry, which means the state or the pension fund or whatever knows a lot more about you than you know about them. And it's possible, therefore, to use that information wisely, or actually can make life difficult for you. And so, there's a lot of this downside risk, the misuse of data, not using it responsibly, using it for reasons to improve, improve the outcomes for the social security or the state rather than for the individual. Those risks are getting more and more larger. So that's something we have to be really aware of. Now, of course, that's not a reason not to do anything, and AI, it's around us, it's happening all around us. So you've got to work with it and take advantage of it. But the positives is this is the gateway to actually addressing some of the great social challenges that we've had for many years that we still have not been able to solve. We still have poverty is widespread. We still have people having housing issues.
Yeah.
We're really struggling to look after people with disabilities and enable them to engage in the workforce. So, the problems that I noticed the speakers today have been talking about the history of social security and and how things have developed over the years, the different models. But the problems those models were set in place to address have not all been solved. And I think that's what artificial intelligence gives us, that opportunity to be able to turbocharge the thinking and the capability of our social policy experts and administrators to be able to really get to the bottom of and come up with actually a whole range of policy responses to address those pockets of disadvantage. As I said, from a technology point of view, doing things online and whatever, hey, we can do more and we can make things better. But are we better off to be focusing more of our effort though on, I need to use this technology to help me get to the bottom of these really difficult problems. And I think if we do that, then the rest will fall into place. Because at the moment, I think it's a shame. I mean, it's a tragedy that with all this technology and all this knowledge, that as I said, we're still seeing some of those most complex, difficult social problems and people being left behind. If you're going to get serious about AI, that's the target you need to be pointing it at. Not trying to make things faster, flashier, shinier.
Exactly.
But still, people still want.
Of course.
They want all that, but Kazakhstan's like Australia. I mean, you're a big country, spread out. You've got population concentrated in a certain parts, small section.
Yeah.
Then you have people living in very rural and remote areas. Very hard to get to, very hard to service. Often they're left behind. In Australia, that's one of our great failings. People in those areas are missing out. And so, we've got to do better. But we can only do better if we think smarter and think differently. And that comes through using the data better. And that's where AI
In
has
your
its role.
research, Sir Brian, in your research, how does Kazakhstan is going on by AI? Does it have so many obstacles, whatever?
Look, I don't see any sort of natural obstacles to AI. Look, we'll come round to a whole range of some of the technical skills itself.
Yeah.
I mean, the technology is a significant step up in where we've been. So in terms of the new roles, the type of people that you're looking for is around data science skills. But that doesn't mean you just need an army of data scientists. You need bureaucrats and administrators who actually have an understanding of data science, but are still social policy experts and are still bureaucrats and administrators first, and then are able to bring some of that sort of data science skill. So, I mean, it is a skills issue, and upskilling the workforce to be able to understand what some of these technologies and the implications of them are, and changing the way we think about data, because we're very good at counting things, and in terms of collecting data. We're actually not so good at really understanding what the data is telling us, and that's where AI sort of opens the door to be able to do a lot of that hard work that is often beyond the size of our brains. We're not, it's pushing our capacity here, but you don't want the machines making these decisions. It's about people making the decisions, and keeping people in control is what is most important. Don't let the technology take over.